Okay, so just a reminder that the recording for the webinar has begun today. Thank you everybody for being here. My name is Joe Simonetti. I'm a clinician investigator at the Firearm Injury Prevention Initiative at the University of Colorado School of Medicine, also at the Rocky Mountain MyReg for Suicide Prevention at the U.S. Department of Veterans Affairs. Again, we're thrilled that you're all here today, and we're thrilled to have our speakers. This is our approximately monthly webinar series that the Firearm Injury Prevention Initiative hosts with the goal of highlighting important work across the spectrum of firearm injury prevention that's happening at academic community settings, school-based settings, with a focus on collaborative efforts that are going on. I am really thrilled to introduce our speakers here today. I had the brief opportunity to meet Dr. Beard in Chicago last fall as she presented on some of the work that she does, which is why I'm really excited to hear more about that in partnership with our collaborators here today. Dr. Jessica Beard is a trauma surgeon and public health researcher at Temple University in Philadelphia. She's also the Stoneleaf Foundation Fellow and Director of Research for the Philadelphia Center for Gun Violence Reporting. As a trauma surgeon, she regularly cares for people impacted by firearm violence and is passionate about firearm violence prevention. Her research focuses on understanding the impact of current media narratives on community violence and exploring alternative media approaches that minimize harm and support effective public health responses. She's here today with Jim MacMillan, who is the founder and director of the Center for Gun Violence Reporting. He's been a fellow at the Reynolds Journalism Institute, the Dart Center for Journalism and Trauma, and the Knight Wallace Fellows, as well as a visiting assistant professor at the University of Missouri School of Journalism and Swarthmore College. Previously, Mr. MacMillan spent 17 years at the Philadelphia Daily News and photographed the war in Iraq for the Associated Press, after which he and his team were awarded the Pulitzer Prize. Mr. Oronde McClain is the founder of the Oronde McClain Foundation and a survivor of gun violence. In April 2000, at the age of 10, Oronde was shot in the head while walking in his Mount Airy neighborhood. He was in a coma for a month, was unable to talk or walk for 18 months. Today, Oronde is a full-time father of 5, beloved husband, and a college graduate who works as a psych tech for the government. The Oronde McClain Foundation advocates for gun violence prevention and helps gun violence survivors. Oronde leads peaceful protests, hosts events to give back to the community, tells his story, and educates others on the effects of gun violence on his own life and on the lives of children in general. This year, Oronde joined the Philadelphia Center for Gun Violence Reporting as the organization's first Credible Messengers newsroom liaison. With that, again, I want to thank you for being here, and I'm going to turn over the webinar to the rest of you. Thank you.
Good morning, and thank you, Dr. Simonetti, and thank you. I'm honored to be here today. We're all honored to be here today. My name is Jim MacMillan. I launched the Philadelphia Center for Gun Violence Reporting in 2020, but it was, for me, the culmination of 40 years' work in journalism education, and some journalism nonprofits. But it's also something I hope to sustain, to continue to operate after I retire someday, as long as we need it. My preliminary agenda when we first got off the ground was to explore the hypothesis that changing the way that journalists and news organizations report on gun violence might actually help prevent violence, prevent shootings, and save lives. Dr. Beard's work, as you'll hear, has refined this mission by identifying harmful reporting practices and asking what the ideal, most ethical, and impactful reporting on gun violence might look like. And we're talking about how to implement those things. You'll hear more about that later. We have 3 core problems. Sorry, I misspeak sometimes. We have 3 core programs. We have 1 core problem, or 2 maybe. But we organized our community reporting. We organized a community reporting project with the intention of shifting power to people with lived experience. And we have many in Philadelphia. Open City data show nearly 14,000 shooting victims here since 2015. We call that reporting project the Credible Messenger Reporting Project, in which community journalists or people from the community with lived experience who are interested in a reporting experience are paired with professional journalists. And Oronde will talk about his, among other things, talk about his experience as a credible messenger. We also have a professional development program to support journalists who are already reporting on gun violence, helping them build relationships and earn trust in the communities they cover. That's important because a lot of the journalists in traditional newsrooms aren't often from those communities, and so we've learned some things about helping them get connected. We call that the Better Gun Violence, or we just kind of call that the Better Gun Violence Reporting, or the Better Gun Violence Reporting, project. Dr. Beard's research. The third program is Dr. Beard's Research Collaborative, which you'll be hearing about today. We have a small team at the center, 4 people, the 3 of us you'll be hearing from today. And also Maxine Gooden is the 4th. She is a co-victim who lost her son to gun violence about 5 years ago. She first came to us also as a credible messenger journalist like Oronde, and now is our credible messenger newsroom partner. But we've got a much bigger network. We've had 36 people participate in the Credible Messenger project, so half community journalists and half professional partners, more or less, with a couple of other production partners. And we have maybe 10 other consultants. We just got off the ground today with a new training consultant, which was very exciting. But we, more importantly, we have a much bigger network. We had 70 people at our Better Gun Violence Reporting workshop last fall, which Dr. Beard is going to talk about. In 2019, before we launched the center, but once we've been working together for a while, well, I've been working with Dr. Beard since about a year before. In 2019, we held our first Better Gun Violence Reporting Summit. We held it at WHLY Public Media here in Philadelphia, and thought of it that more as a national event. And it was a risk, right, to try something new here. And it was very exciting to find that 250 people attended. We had journalists attending from everywhere from the New York Times to the Los Angeles Times. I would say from Boston to Orlando. Geographically, we covered everything, but across media as well. We had new media. We had traditional media organizations. We had new media, digital first organizations, community media organizations, freelancers, and just about everybody else you can think of. On stage we had researchers from various realms related to gun violence prevention, and realms of disciplines related to gun violence prevention. And we had journalists who cover gun violence locally and nationally. And we had a panel with community representatives, again, with direct lived experience, who are all from Philadelphia. Okay, so that's who we are. And I know this will be more time for questions later. And Dr. Simonetti, at this time, I'd like to hand it off to, I'd like you to introduce Oronde, who is going to talk about his Credible Messenger experience, about his new role as our Credible Messenger newsroom liaison. And before we do, I just want to say how grateful I am, to be here, of course, but especially to have people like Dr. Beard and Oronde join me in this work.
And good afternoon, everybody, and thanks for the introduction. Yeah, my name is Oronde McClain. I got shot in the head at the age of 10, maybe it was like 23 years ago. And that was a horrible feeling. I'm partially paralyzed on my whole right side of my body, and I was like angry at the whole world until I met Jim. He gave me an opportunity to express how I was feeling through the Credible Messenger project. I wanted to attack the world. I wanted to attack the politicians and the doctors because I was upset. And I was paired with a great professional journalist, and it let me understand how I can express my feelings through the art and journalism. So I did a project. I interviewed 3 survivors, 2 doctors, and two politicians, and it changed my whole life. I thought a lot of people was just angry like myself, but they wasn't. Politicians and doctors, they went in this field because a lot of people in their life was directly affected by gun violence. Me being a survivor of gun violence, I thought that I was the only one affected by gun violence, and I was wrong. So this Credible Messenger project made me realize everybody is affected in their own way. And I'm just very appreciative to Jim and the whole PCGVR because it made me realize, it made me be a bigger person. Now, my new role as the newsroom liaison, I'm in contact with every newsroom, the biggest newsrooms in Philadelphia. I can name them all. It's a lot. And I talk to journalists, and journalists, they have the same problem. They just give them their boss give them a task, and they just have to come to cover these stories. They really don't know they're doing harm. They just want to do the best job. And I talk to them. We have weekly Zoom meetings, and they feel awful as well. But you can't blame them for doing their job. They don't know they're doing harmful reporting. So I'm glad that I'm here to tell them and work with them every day to to let them realize that they're doing harmful reporting, but they're great at transforming their work. Um, that's all I have to say.
Hey, thank you, Ronnie. If I may ask, interject one more question, and I have many, but I think it's really exciting to share what you learned by interviewing other victims, how they reacted to you versus if traditional journalists had come from, like I used to be, had come from a mainstream newsroom. Was there a difference?
Oh yeah, it was total. Thanks for asking, Jim. A lot of victims. I give you one example. Leon, he got shot, and I tried to find him on social media. You know, you can find anybody on social media. And I inboxed him. I said, "Hey, my name is Oronde," and he automatically said, "Like, you're a reporter. Don't exploit my story. I don't want to talk to you." And I'm saying, "Listen, I'm a victim too. Like, it's okay." So that being said, a lot of victims don't like to talk to reporters because they feel like they're going to exploit their story, or they don't know how to interact with them or come off them in the wrong way. It's a lot of victims and the survivors. They don't know what to say to them. Like, perfect example, I don't like when somebody says, "Hey, Aronde, I know you're a victim of gun violence." Like, no, I'm not a victim of gun violence. That was 23 years ago. Now I'm a survivor. I'm not on that wave anymore. I'm a survivor. I went over that hump, and I'm proud to be a survivor. Don't dumb down to me saying that I'm a victim, because I'm not. And it took me a long time to realize that I'm a survivor now. But when news reporters saying victim of gun violence, or they categorize me as a number, or they group me as a statistic, we don't like that. And a lot of survivors don't like that as well.
Thank you. And again, I'm just so grateful to have you with us. Thank you for sharing all of that.
No
And for
problem.
everybody's benefit, you can always go to our homepage, pcgvr.org, click Credible Messengers, find a lot of those reports, including the one that Rondé produced, and I highly recommend spending some time with it. Dr. Beard, do you want to step in?
Yes. Thanks so
Thank
much
you.
for sharing that, Oronde, and for talking about the center, Jim. So as you heard, I'm Jessica Beard. I'm a trauma surgeon. I work at Temple, which is in North Philadelphia. Our hospital sees the largest number of firearm injured people in the entire state of Pennsylvania. So I have some PowerPoint slides. I'll share my screen. And basically what I'm going to talk about is a little bit of kind of context around firearm violence in our city, some of my previous research on firearm injury epidemiology, and then some kind of theoretical basis and research on media reporting on firearm violence. And just for a little bit of background, I mean, you might wonder why, as a trauma surgeon, interested in how the media tells the stories of firearm violence. And there's really two reasons. The first one is that it actually, for any of you who take care of people who are injured by interpersonal firearm violence, it comes up. You know, we hear things like, well, I was delivering bad news to a mother of a child who was shot, and she told me she'd already seen the status of her child on the news before I was able to talk to her. We've had situations where incorrect or inaccurate things were reported on the news that caused a lot of distress for family members, and we had to kind of do, a lot of support after that. And then I've heard directly from patients, I wish I wouldn't have made the news for something so negative. And then on a personal side, when I first moved to the city from San Francisco, where, there's certainly a significant amount of interpersonal firearm violence, but not to the scale that it is in Philadelphia, I actually went to the news myself to try to understand, what the drivers were, and found what I later learned were episodic crime reports. And I have an example of that for you to see here. And I thought that is not my story at all. So it certainly probably isn't the stories of the victims. And it's just, even small things about public stories for which maybe I cared for the person can cause me angst. So I can't even imagine, what it's like to be a survivor of firearm violence and experience that. So that's sort of my preamble, and here comes the slides. Hopefully this will work. Thumbs up. You can see the slides.
Yes.
So, and I just want to say a little bit too about language, because I know that that's something that your group is actually well known for, which is, being kind of thought leaders on language. So you'll notice that we have the Philadelphia Center for Gun Violence Reporting. The title of this sort of project colloquially is Changing the Narrative on Gun Violence Reporting. And you'll see later in the talk reference to community firearm violence. And I think it's important to think about the language that we use. We've talked a lot about this at our center, actually, and Jim and I have slight disagreements about it. So for now, those are the two terms that you're going to see, and they're meant to describe interpersonal firearm injury that is sort of the most prevalent type of firearm violence in our city in Philadelphia. So I began my work in research on community firearm violence by looking at data sources. This is back several years ago in some of the earlier days of research on firearm injury epidemiology. And this is actually the first study that I did on firearm injury epidemiology using and comparing two available data sources. Data from the Philadelphia Police Department that at that time I obtained from them, but now is publicly available, as Jim mentioned. And then our trauma registry data. And you can see that from 2005 to 2015 in the city of Philadelphia, both data sources showed really what is a steady decline in shooting incidents. And from this study, we were able, with some other kind of analysis, to really establish the Philadelphia Police Department data as our epidemiologic data source for tracking interpersonal firearm violence or community firearm violence in our city. And you can see from 2016 to 2020, we were in a relatively steady state, of still too many shootings, but there was certainly no increase or spike happening until, I don't like to say the front lines, because honestly, the war metaphors are very challenging, but on basically responding to firearm violence on a daily basis and responding to COVID, it became very clear that while other types of illnesses and hospitalizations for other illnesses were declining after the closure of non-essential businesses in our city, firearm violence was spiking. And so we were able, because we had established that data source as our epidemiologic source, to really track this in real time and determine that firearm violence began to spike around the middle of March of 2020. And since then, we've seen essentially what is double the rate of firearm injury or community firearm violence incidents in our city. And we've really reached some very grim statistics, and we have sort of numbers of shootings that are similar to the 1990s. And just on a personal note, it has been incredibly anguishing to, deal with this volume of interpersonal firearm violence as a trauma surgeon. And, I was always passionate about firearm violence prevention before, but this has really, sparked me to continue along in this work. We also looked at who was impacted in kind of the post-pandemic period when it comes to community firearm violence. And what we found was obviously not only were double the number of women and children being shot, but actually proportionally women and children were more likely to be shot following closure of non-essential businesses. And we had more mass shootings. We've done some epidemiologic research looking at mass shootings as defined from the perspective of neighborhoods. So as defined by number of shootings and time and space, rather than sort of the law enforcement definition of from the shooter perspective. And the incidence of those actually doubled proportionally as well in the post-pandemic period. And we at least see this as further evidence that community firearm violence is structurally determined. So when you're in a situation where you have lost a lot of things that we know that are protective against community firearm violence, like access to safe green spaces and school and social services and, appropriate healthcare, then, that's when you see, as a community firearm violence spiking. Our research has shown that community firearm violence is structurally determined. We have empirical evidence, thanks to work done led by colleagues from Penn and Penn Nursing that I also participated in, that, it was essentially a spatial analysis of redlining and modern day firearm assault locations or community firearm violence incident locations. And we found that, there's a dose response risk, essentially how sort of marginalized the neighborhoods were reaching back into the 1930s determines where community firearm violence happens today. And the areas that were redlined in the 30s, where people were not allowed to obtain loans for home ownership and intergenerational wealth, was essentially stifled and racially prevented. Those are the places where people get shot today. And so it follows that people who, like women and children, who are most structurally marginalized would be the people who are most impacted, in a post-pandemic period. So where do we start? How do we address community firearm violence, right? Of course, it's public health. So there's lots of, angles to take, and so many different types of solutions are needed. And for me, I feel like one of my biggest concerns that I have, especially in participating in public conversations about community firearm violence in our city, is that we talk a lot about root causes, but we don't really address them. And, it's always been a challenge to really understand why we aren't aiming our solutions at root causes, and why we don't have as much public support as you would think for proven or effective programs and policies. And, that kind of led me to, understanding this disconnect between what was my experience, what I know about community firearm violence and all the research, and really, what you're seeing on the news, and probably what the average Philadelphian would know about community firearm violence. And it led me to this question. And us to this question: what if media reports could actually prevent firearm violence, or they could at least not cause harm? And that's really an evolution too, because I think what we're learning is just how harmful these media reports are. So here's a little crash course in, communications theory, which I've had to learn. And thankfully, we have a phenomenal group of research team that includes journalism scholars. So the question is, how do the media exert influence? And I think I'll just say that we know that the media do exert influence. We know that, depending, and we saw this very well with COVID, so I think we're very familiar with this. But, the reporting on a vaccine, for example, there's studies on flu vaccines and COVID vaccines actually can increase the uptake of vaccination. And how did they do that? So the three kind of general, and this is pretty simplistic, but the three kind of general ways that it's thought about is through agenda setting, priming, and framing. Agenda setting is when topics that are covered more frequently and prominently gain more importance in an audience's thinking. And so an example of that media agenda setting would be like mass shootings. Okay, so a traditionally defined mass shooting is, the one in a public space, maybe at the school, that involves multiple people, right? Those receive national news coverage. And when people are polled, when Americans are polled and asked how frequent are these mass shootings, which we know are less than 1% of all shootings, people think that they are actually the most common type of firearm violence that we have in our country. And people are actually very afraid of this risk. And that has to do with agenda setting. Priming is when news content serves to suggest standards that audiences should use to evaluate issues, institutions, and individuals. So an example of this would be, President Biden is not that interested in, preventing gun violence, let's say, and the journalists from CNN come and say, well, what's your policy on, universal background checks? Or, I know he's signing an executive order, so that's a bad example, but that would be priming, right? The media can actually suggest something as a topic of conversation and a way to judge a politician. And then finally, framing, which is really what we focus on largely in our research and content analyses of TV news. Framing is the way that news media approaches a topic, and it can influence the audience's understanding of the topic. So it's long known that crime reporting is highly racialized and promotes racist stereotypes about Black people. Specifically, we know that Black people on, things like Action News and Eyewitness News, which, by the way, were invented and created in our city in Philadelphia, that they more commonly portray Black people as the perpetrators of crime. An example of something that's very harmful is mugshots, and criminalizing. And they less often portray Black people as the victims of crime. And so then it creates, and perpetuates and upholds these racist stereotypes. And so we have this situation of community firearm violence where, you already have this kind of racialized perception of it. And then depending on how a story is told, it can really reinforce those stereotypes. So this is a table from our kind of first foray into research on reporting, well, maybe the second, but reporting more generally about community firearm violence. And basically, there's not a lot, as you know, if you do firearm injury research, there's not great data sources. That's one of our major challenges. And so the way that we did this study was we looked at, we asked the question, who makes the news? That was basically the research question. And we compared, again, using police data, shootings from police data sources in 3 cities, including Philadelphia, but also Cincinnati and Rochester. So basically a convenient sample of places that had publicly available police data. And we compared it with gun violence archive data. And I would love to talk more, if anyone's interested in data sources, what this study actually says about gun violence archive data. But basically, we kind of use gun violence archive data as a proxy for you made the news. And what we found is that only about half of all shootings that were in these police data sets were in the gun violence archive data. So we extrapolated that only about half of people who get shot make the news. And we found that people who were shot fatally were much more likely to make the news than non-fatal firearm injuries. Again, what an incredible tension between what's rare and what makes the news, right? And we also found that if women and children are much more likely to make the news when they get shot. Again, kind of the rarest, victimatology. And then we found that mass shootings or shootings that involve multiple victims were more likely to make the news than single victim shootings. And there's a couple of other kind of studies that are somewhat similar in terms of sort of comparing epidemiology of homicide versus what makes the news with similar findings. So this kind of reaffirmed that. And I think that this is important data to have when we hear from journalists that the reason why they do the type of reporting that they do is for public safety. And the response is, well, only half of people make the news. So that can't necessarily be your goal. I just want to share a news clip from our TV news content analysis to give you a sense of, sort of what we're talking about and sort of what the prevailing style of TV news reporting looks like. And hopefully the sound is going to work.
At 11 tonight, Philadelphia police say a woman is fighting for her life after being shot on the back of the head in Kensington. It happened at 9 o'clock in the bedroom of a row home on the 3000 block of Ruth Street. The 34-year-old has been rushed to Temple University Hospital in extremely critical condition, though arrests have been made. A 14-year-old.
Were you able to hear that? Relatively well. So, this is kind of a standard report on community firearm violence that we see on our TV news. And we know that actually from recent research in Philadelphia that most people are still getting their news from TV news, and even people who get news on social media oftentimes see these type of TV news clips. And, if you watch enough of these, you'll see they follow a standard script with very basic information about the victim. And oftentimes they do include the, hospital, the condition of the victim, things like extremely critical condition that just make smoke come out of my ears, because if you're a clinician, that's not a thing. And those we learn later from our patients that those kind of things are also causing a lot of anxiety for patients as well. So this is what journalists or media scholars call an episodic crime report. So you saw it. It's focused on a single shooting event. And if you know anything about Philadelphia, you know that even the kind of idea of Kensington and saying that a shooting occurs in Kensington will bring in a lot of stereotypes about who the person was and why the shooting happened. Kensington is a place where there is just really the epicenter of our opioid epidemic and fentanyl crisis. It's framed as a crime issue, right? The narrators are police. You'll hear police say, sometimes if there's a journalist on the scene, you might actually hear from the chief inspector. That's it's that same script, the police information. And we know from media scholarship for decades, we've known that this type of report can reinforce racist stereotypes about impacted people. It can lead audiences to blame the victims rather than holding social structures accountable. And it really supports this idea that the only people responding to gun violence are police officers. And it's at least my theory as to why you'll oftentimes hear people who are consuming news like this really offer police as the only solution. They don't see other solutions. Other solutions are not presented. And what that effectively does is really undermine what could be effective public health responses, and certainly, detracts from potential educational opportunities for the public. So at the Philadelphia Center for Gun Violence Reporting, we're trying to make firearm violence reporting better as a public health intervention. And we're collaborating with researchers, with people with lived experience to advance empathetic, ethical, and impactful journalism, as you heard from Jim. And our goal really is to reframe the media narrative in order to educate the public through a public health lens, which we're still figuring out what that is, and I'd love to discuss that. Through new narrators that aren't just police, but that also represent the perspectives of firearm injured people, co-victims, and people who do research on community firearm violence, and people that are involved in solutions. I think it's easy to, if you watch an episodic crime report, think something very negative about the person who shot. And without context or root causes, those perceptions can persist. And very importantly, and what's really come out of constantly out of our work is that reporting should be trauma informed, just like the clinical care that we provide to injured and traumatized people should be trauma informed. So I lead the research effort at our center, and our research portfolio for now includes a study on the perspectives of firearm injured people on reporting on firearm violence, a content analysis of local TV news. We engaged in a collaborative workshop led by human-centered designers and used design thinking to create outputs. And then I'll finish with our unanswered questions. So one of the studies that we've completed at the center is a qualitative research study, which, as you know, is really kind of underrated, I think, in sort of medical and public health research, but it's certainly a great place to start when a topic has never been studied. And we actually found that nobody had at least published a paper asking firearm injured people what they thought about reporting on their own injuries. So that's what we did. We asked 26 recent firearm injury survivors at our trauma clinic within 2 months of their injury, so people presenting for follow-up. We created a questionnaire. This was in a collaboration with, again, our research team, which includes a qualitative researcher in nursing, a journalism professor, and then we worked with our Center for Urban Bioethics just to make sure that our questions were trauma informed. We interviewed our patients, we tape recorded and transcribed the interviews, and we conducted a thematic analysis. And well, first of all, we found that half of people who we interviewed didn't make the news, or they didn't see any news reporting on their injuries. And that goes with our previous research. And we let people really define what they thought was news. So a lot of people, considered social media to be news. And so we were really open about that. But again, most of our patients told us they do get their news from the TV or social media. And basically, we saw really what is a preponderance of harms identified by firearm injured people around kind of news media narratives on their injuries. So and I'll present some quotations. So just briefly, firearm injured people felt dehumanized by narratives around their shootings when there was graphic imagery, or even sometimes just imagery of a crime scene that led them to relive trauma of their shooting. Inaccuracies were extremely distressing, even things that might seem kind of small to us, like the number of gunshot wounds. When somebody has 4 bullet holes on their body, we count that as 4 gunshot wounds, but to a firearm injured person, that's 2 gunshots, if they went in and out. So, and that's something that was really enlightening to me, and it highlights how important it is to be trauma informed, because small inaccuracies make people really lose control of their narrative when they've already lost control from their injury. There was a major concerns about threats to personal safety, especially when the treating hospital or the condition was mentioned, both of those you heard in that clip. Harm to reputation was a very notable finding. Specifically, there's a huge stigma around getting shot. There's a lot of kind of biases that come with being victimized by firearm violence. And when a story does not, explain the circumstances, the context, or your innocence, if you will, that cause people, even for their family members, to call them and ask them, what were you up to? And then very importantly, and what we're hoping to study further, there were several interesting hypotheses about the impacts of this episodic style of reporting on public safety. For people who didn't make the news, honestly, most of them were relieved. They don't want to make the news when this is the type of reporting that they will have, which doesn't mean that they don't want to talk to journalists or that they don't want to tell their stories, as we heard from Oronde, but it means that they want to have more control over their narratives. That's my interpretation in any case. And I will point out that none of the people who we talked to were approached by a journalist to tell their story, despite their shootings making the news. So here's what one of the participants said. She said, "They didn't ask me any questions. There was no calls made to me or talk to me personally. They didn't tell the story from my perspective. It was like she was shot and that's it. I would prefer if they asked me specific feelings about me, if they actually interviewed me, instead of just writing it like I'm a nobody." And I think this is one of the most powerful quotations from our study and that we learned, which was basically what it feels like to be that woman shot in Kensington. It feels like you're a nobody. It feels like you have no control over your narrative. It's like the first thing people think when you get shot is that you did something, but people don't even understand. I literally was going to see my daughter and I was going to the dentist. Instead of saying man shot in North Philly, say innocent man shot in North Philly, because I don't like people just looking at me and looking at my situation and painting a picture. So again, this you can tell this narrative was man shot in North Philly, right? There's a lot of associations that go with that. And he is explaining that stigma that comes without exculpatory language or without humanizing language in an episodic crime report. And finally, you report the gun violence, but why not do a follow-up report for the victims, the survivors, the families that had to bury these people, the whole process? Just don't do a guy got shot over there, a guy got shot over here. You're making people more fearful. You're more fearful. You're going to arm yourself more. This is incredibly powerful, right? This is somebody who's connecting directly, guy got shot over here, episodic crime reports with fear and firearm purchasing, like we saw during COVID. And of course, we know firearm purchasing increased community firearm violence. I just want to make a plug for sharing research in perhaps non-traditional ways that we don't think of as researchers and academics. So, we talked with quite a few journalists about the results of the study. We actually, even talked to the journal about when to put it out because it was published in an open access journal. It's newsworthy when a research study gets published, even though you've been working on it for years. And so, the last thing we want, the reason why we're doing this research is to make things better for our patients. And the last thing we want is to just do the research, write a paper and, put it away on a shelf or somewhere on the internet. So again, talking to journalists about your research is key. This is available on our website, but it is a short film made by a local filmmaker who also participated in the Credible Messengers reporting project. With dramatic readings from the participants in our study that I think is really powerful. We're doing a TV news content analysis. I'll go through this briefly. It's ongoing. It's a ton of work to do visual and clipped content analysis. We have clips from January through December of 2021 that we downloaded from a publicly available source called TVI's. And the question is, to what extent is firearm violence framed as a public health problem on local TV news? So sort of getting at how often is it this episodic crime report versus how would the public actually understand it as a public health problem? We have about 7,500 clips. You can see, interestingly, the number of clips, and these are from all 4 of our local TV news stations at 3 times, and they're all about gun violence. It doesn't really follow the epidemiologic trend of shootings in the city. So, we know that February and March are the months where there's the least amount of shootings, and that in the summer there's more. But to look at it, you'd think April was the month with the most shootings. So that's just sort of a basic interest in terms of epidemiology. I've included, sort of the elements that we're collecting, whether a story is episodic, who the narrator is, whether there's harmful patient-identified content, the visual imagery, and how often a public health perspective is presented. And basically, as expected, although this has never been done in Philadelphia, it's really only been done in California. The vast majority of reports are episodic crime reports with that episodic crime frame. The public health perspective is very limited. In fact, we've coded over 100 clips, and only one of them even uses the word prevent in the clip. We're hopeful that these results will just really provide some sort of empirical evidence on what the current state of gun violence reporting looks like. And our journalism colleagues are planning to use the clips. This is an incredibly rich resource to do experiments to see, what types of clips sort of make people, not make people, but sort of influence people's perspectives on root causes, solutions, and how they make people feel. We hosted a better gun violence reporting workshop that was really inspired by the result of the study with our patients, and urgently inspired with this need to really improve the way we're talking about gun violence in our city. That was back in the fall of 2022. And we used our network at the center to invite a really wonderfully diverse group of people. We had 70 participants in the entire day, which included journalists from all of our local newsrooms, community leaders, survivors, co-victims, and scholars, though certainly not heavy on the scholars. And then we brainstormed around, challenges that had been identified by the research and by our ongoing work. And then we actually worked with a human-centered design lab called the Better Lab, which is out of UC San Francisco. It's a prototype solutions. Basically the kind of short story is we kind of voted on the best prototypes. Groups presented their work, and there were a couple of similar prototypes, and the kind of award-winning ideas were the creation of a hub for community journalist connections and resources, which we are working on, and training in trauma-informed and evidence-based community firearm violence reporting, which we are, looking to call gun violence prevention journalism. And to go hand in hand in that are planning for training in media literacy. We have several unanswered questions. I think a very important one is, does harmful reporting actually impact community firearm violence incidents? So we have a plan to study that, and we've applied for some research grants for that. We would like to track harmful reporting in real time. And so what metrics should we use, and how can we do that? What is effective public health framing? One thing that we learned, and I'd love to hear what people think about this, but one thing that we learned from our workshop is that even the term public health has a branding problem. I think when all of us who are maybe providing medical care think of public health, we think of all the things that we can't do with medicine. We think of prevention. We think of community-centered work. But the truth is that public health has a lot of problems too. Public health is the capital public health, and then investment in true public health approaches to firearm violence are limited and haven't been super effective, frankly. So how can we help people understand that there are alternative solutions, but not necessarily push public health on people? And then how can we implement these best practices? How can we actually change people's behavior? I'll just provide a little anecdote about sort of suicide and reporting on suicide. And this is sort of where where we're sort of modeling some of our scholarship and our work after. So several decades ago, reporting on suicide was sensational and was for spectacle. And with research, including really hundreds of papers that showed a contagion effect of harmful reporting practices on suicide. Those research studies, most of them were done in Europe, actually, were used to inform guideline development and inform, education of journalists. And so now you will not find, and for better or worse, right? Maybe the solution is maybe there's less awareness, especially of firearm suicide, but you will not find sensational reporting as much on suicide like you do on community firearm violence. So we're trying not to just immediately go out and say this is what your reporting should look like without evidence. And we're trying to sort of build a research around what is harmful and what will be helpful when it comes to community firearm violence. This is just a little bit about public health reporting on violence. Really, the thought leaders, if anyone's interested in this, are the Berkeley Media Studies Group, the original thought leaders, and Lori Dorfman. And she has some research and recommendations for what public health reporting on violence might look like. She says it should include epidemiologic context, individual and community consequences, risk factors, and resources. And I think a lot of these are really valid. I mean, they sort of look like this CDC approach to injury prevention. But I do think that when you are thinking about, an attempt to, have this work minimize the harm or risk of racial stereotypes and really maximize structural interventions and public health interventions, some of this rethinking around risk factors and even this reaffirming of individualism, I think can be helpful. There's been very few studies, but the one kind of major study that evaluated this public health approach to firearm violence and how audiences responded to it found that people kind of thought this was boring, and while it did sort of maybe improve kind of the perspective on community firearm violence, or this was on crime, people didn't respond to it as much as something that was a little bit more sensational. So how to actually get this message across and make it interesting in what is fundamentally a business of journalism really needs more work. Newsroom structures and incentives are there, right? Like the crime beat is there. It's a structural problem. There's people assigned to it. They go out, they tell these episodic crime stories. So we're working on how an episodic story could actually be more humanizing. And again, the public health concerns and maybe perhaps communicating what we actually mean by public health is very important. This is my last slide. I just, again, I kind of want to make a plug for, breaking down barriers between patients and doctors. This is one of my patients and his mother, a patient that I took care of for years and I'm still taking care of. And once he had sort of healed from all of his issues, physical issues related to his gunshot wound to his abdomen, his mom came and said, was there anything that I can do about gun violence? And so she participated in our Credible Messengers reporting project, which was just an incredible experience to get to hear her and participate in her telling her story from her perspective. I'd like to acknowledge Jim. This is our research team of journalism and nursing scholars and our trainees, and Stoneleigh, who funds my work. Thank you.
Outstanding. Well, thank you. That was really, really fantastic. Just a mention to the audience, you can post any questions in either the Q&A box or the chat box, and I will make sure that we get to them. I'm curious, I'll start off before you get to the box. I'm curious, have you been able to share some of your findings about the impact of reporting with actual folks in the media? And if so, like, what has been their response?
I can take that one. So after we had kind of completed this research study and the qualitative study with patients and were writing it up, we actually presented it to several of our local TV newsrooms. We're invited to present the results of the work. And we had mixed reviews. You know, it was interesting. I think maybe there's a poor appreciation for qualitative research, even among journalists, which I found fascinating because that's really what they do, is interview people. So there was that. It was like, well, what do most people think about this? This is just a few people. I think that, you know, we kind of know all of the things that we're going to hear. Yeah. You know, when it comes to why episodic crime reporting continues. But we are super engaged in sharing it with journalists. And most of the people who attended our workshop, which, you know, there wasn't a PowerPoint presentation of the research. We actually printed out the patient quotations and lined them up as people entered into the workshop. So they were there with us, and there was discussion around them. But most of the people who attended our workshop, you know, got a sense of what people think. And the thing is that, like, I don't think that journalists don't know that this is a problem. A lot of journalists want to do a better job. They just don't necessarily feel like they have the tools, or, you know, when you're sent to, you know, report on a crime scene, you might not, you know, again, have all of the tools to do that more ethically or less harmfully. So I think it's a work in progress, but we certainly are presenting our work to journalists constantly, as much as they will listen.
Thank you. We have a few questions in the box, and actually they're in some ways related, so I'm going to do my best to sort of lump them here. Jessica Buck-Atkinson said, are there any existing guidelines or resources for media organizations to improve their practices? Jennifer Brooks said, how do I bring this message to my local paper? Are there any overview documents to open that conversation? And Rebecca McCracken said, if a community group is interested in convening media to address how they cover gun violence, do you have resources you could provide? So all three of those are about, can we engage media? And if so, like, how do we engage them? And are there existing resources that we can use to frame that conversation?
Do you want to answer, Jim?
Sure. So I'll jump in. So I guess it's perhaps a little bit different for researchers versus community groups. For the most part, the one incredible resource is that journalists live on Twitter. So and you can search profiles, of course. So you can search by topic, you can search by locale, and there's a, I don't know that of the link, but there's if anybody doesn't know, there's an advanced Twitter search function. So you can find all the journalists, and they're pretty responsive for the most part. So that's a way to break the ice. Now, convincing them can be something else. In general, there are where else do you find journalists at conferences and such? But how to get a community response is a little bit different, and and I'd say strategies vary. Some organizations are a little more confrontational about it, and others try to be more collaborative. I think we're having more success that way so far.
And I guess I would just say, for the question about resources, like, let's say that you wanted, you know, access to resources on describing sort of what trauma-informed journalism might look like, or sort of what more ethical or humanistic reporting might look like. First of all, we have a website. It's pcgvr.org. We have a list of resources on our website. We're actually working on, you know, making those maybe a little bit more sort of handy for journalists too, like pocket type resources. That's something that came out of our workshop as well. So you can always check out our website. The DART Center for at Columbia is really the kind of flagship for trauma-informed journalism. The Society of Professional Journalists has a code of ethics. So I mean, the truth is that episodic crime report violates that code of ethics. You know, it's not, you're supposed to use more than one source when you're telling a story. So that can be helpful just to kind of framing during discussion with journalists, but different than sort of medicine and public health. I think journalism is kind of a much less, I don't want to say organized, I guess that sounds kind of judgmental, but sort of a much less, professionally organized profession, if you will. So I think that there's a lot of freedom in terms of who gets to say they're a journalist and what their training might be, and sort of accountability. And I do think that accountability to the people that you're reporting about is very important. The other thing that I would say is, it sounds kind of silly, but like op-eds can be really, really meaningful. So Jim and I actually, the first thing that we did together was write an op-ed about better gun violence reporting and highlight what it might look like. And, we were sort of immediately met with friends and foes, if you will. And I think that those can be powerful, especially if you're, a public health person. And then the other thing to think about too is like, what is your narrative? If you get that opportunity to talk about your research study with a journalist, like what narrative are you going to present, and maybe refining that, working on that, because a lot of us get nervous and things when we talk to journalists. And then being a resource to a journalist, I think that like one of their challenges is that they have this direct access to police. The way that it goes down in Philadelphia is the police send an email with all the people who get shot, with that. I don't know if you saw that slide, but with exactly that information, that's actually cut and paste from the police press release that's posted on Twitter. And journalists just don't have the same kind of access to us and to people with lived experience that they do to police. And so, probably the most benign viewpoint is that it's just kind of like a little bit of laziness, that's how those things get perpetuated that way. And so offering yourself as a resource with maybe a trusted journalist, or even just as an educational resource. I mean, a lot of times I've done a lot of interviews about gun violence with our local journalists, and so much of what I'm doing is actually education with the journalist, and maybe it doesn't make it into the report. Sometimes they don't even make it into the report at all. And that's okay, right? Because like, that's part of what we're engaged in as well, especially if we have the time.
Thank you. We just got about 2 minutes left. I have one more question, and maybe Mr. McClain, if you don't mind. Do you have any recommendations? So I'm looking at our audience list here. We've got some researchers in public health and firearm injury prevention. What recommendations or guidance do you have for folks working in this sphere who ultimately want to share what we find with the media?
I say always email, and I always email, I always call, I always reach out. It's the difference when a survivor or victim reach out, because it's meaningful. And I feel like journalists always, they want to do a follow-up, but it'd be so hard because there's all these breaking news. So always try to do a follow-up.
That's really helpful. There's guidance published out there for research and how you engage stakeholders and other interested folks and people that this impacts. I'm not sure our community has done a great job of actually following those recommendations. So thank you. It's in line with that. Okay, it is the top of the hour. With that, I again want to thank the 3 of you for being here. I think this is just extraordinarily important, not just in terms of highlighting a huge problem, but thinking about the impact of media and how it can actually worsen our problems, or how it's a potential solution to some of these issues. So again, thank you, and I appreciate your time. And with that, I'll conclude the webinar. Everybody have a nice day.
Thank you.
Thank you.